Growing up, Janet Beegan spent many hours on Long Island beaches.
I always laid in the sun. I mean, I used to put no sunscreen, used to put baby oil on.
Basal cell carcinomas are the most common type of skin cancer, highly treatable and least likely to spread. Beegan saw her first in her late 20s.
How they treated it was a biopsy, then you'd have to wait, make another appointment, go back, then they would scrape and burn, and take another biopsy, and then if you had any more, you had another scrape and burn.
A lot has changed since then. For the past 5 years, Mount Sinai dermatologist Orit Markowitz has been treating Beegan using this OCT device, short for optical coherence tomography. It uses lasers to look beneath the skin without having to do a biopsy.
When we cut the skin out, we only look at one tiny section. With this device, it's like we have 160 sections. So it's like a flipbook animation of sections. So we're able also to see things that we wouldn't even be able to see in pathology.
With OCT, Markowitz is able to tell her whether an anomaly on the skin is the beginning of a basal or squamous cell carcinoma before the tumor really starts to form. In a study conducted by her team, 48% more basal cell carcinomas were detected through OCT than by regular clinical examination.
In addition to preventing unnecessary cutting and cosmetically challenging areas, it's also to be able now to diagnose things substantially earlier in cosmetically challenging areas.
Eliminating the need for surgery in some cases, like with this basal cell on Beegan's leg. She was able to apply cream. Now it's all gone.
It's kind of nice. It's all done in one visit. I don't have to come back, schedule another visit until a few months later to follow up.
It's a standard part of care for Markowitz's patients, but certainly not standard in the U.S. At this point, the FDA-approved OCT device is only used clinically at Mount Sinai, though it is popular in Europe. ERIN, BILLUPS, New York 1.